mostly that it had absolutely nothing to do with health care. For example, under that study, the U.S. got marked down because we don't have a sufficiently progressive income tax structure in this country. We also don't have an aggressive national anti-smoking campaign. That cost us several points. Well, we actually finished #1 when it came to patient satisfaction, but that was one of the more minor things in terms of the grades overall. Another thing you hear people talk about quality in this country, the president talks about it, Michael Moore talks about it. We have a lower life expectancy than some other countries. Now, they live longer in Britain and Canada. So therefore, they must have better healthcare systems. The president, President always says, we pay all this, and the other countries, they live longer than us. But I can tell you that the healthcare economists are almost unanimous in the idea that life expectancy is a terrible measure of a country's healthcare system. Because there's so many what an economist calls exogenous or outside factors that impact life expectancy. Lifestyle things like obesity and so on. But also things like murder rates, suicides, auto accidents, all things the U.S. sort of leads the world in. These are all things that impact life expectancy. You know, if life expectancy was the measure of how good a healthcare system is, how do you explain the fact that people in Utah live 3 years longer than people in Nevada with essentially the same healthcare system? It may have to do with things outside of healthcare. Similarly, you know, people talk about infant mortality. But again, it's a terrible measure of a country's healthcare system. For one thing, the definitions are so bad that the OECD, the Organization for Economic Cooperation and Development, sorry about the acronym, but they actually they say don't use infant mortality statistics to compare across country borders, because the definition of infant mortality is very different from country to country. In the United States, if a child is born, takes one breath, and dies, we consider that a live birth, and it's part of our infant mortality statistics. There are countries in Europe where a child can live 12 hours, die, and is recorded as a stillbirth. Likewise, in this country, many children with problem pregnancies are brought to term, whereas in other countries they're aborted. Cuba, which is always cited as having such wonderful infant mortality statistics, almost all problem pregnancies are aborted in Cuba, never brought to term. So you don't get the problem of the child being born and then dying and adding to statistics, which is the case in this country. So again, I think it's a very bad measure of the quality of a healthcare system. I think a much better measure is what happens if you get sick. What are the outcomes for various diseases? And here, the U.S. is simply at the top of the charts for almost every disease. The British medical journal, The Lancet, just did a study, terrific comprehensive study, looking at 5-year survival rates for cancer. For all the different types of cancers, they looked at all the different ones combined. And they said, what percentage of the population survives at least 5 years with cancer? The U.S., for both men and women, was #1, and we beat our next nearest competitor by a full 5 percentage points in both cases. The different countries, the #2 were for men and women was different. But we were #1. Same is true at 10-year survival rates, 15-year survival rates, 20-year survival rates. Same is true for heart disease. Same is true for AIDS. Same is true for pneumonia. You can pick your illness. Your chances of survival are better in the United States than almost anywhere else in the world. So when we go out to say we want to fix health care, we need to be very, very careful that we don't undermine the innovation, choice, and quality that is so good about our healthcare system. Now, that doesn't mean we don't have problems. We do. Now, the fact is, we spend a lot of money on healthcare in this country. It costs a lot. We spend more both on a per capita basis and a GDP basis than any other country in the world. We spend 1/3 more than our next nearest competitor, which is France right now. So we spend a lot of money on healthcare. Now, I would have a little bit of caveat to that, a little caution. The United States spends more on everything than any other country in the world. Little known fact, we spend double the next leading country's expenditures on running shoes. And no one else has come up to me to talk about the great running shoe crisis facing this country yet. The fact is that healthcare is what an economist calls a normal good. That means that as incomes rise, expenditures rise. And we are a very wealthy nation, and we all want to live forever. So we choose to spend our discretionary income as a nation on healthcare as opposed to other goods and services, toasters, refrigerators, or whatever it might be. This may be good, it may be bad, but it's sort of in many ways where we want the money to go. Now, people say, well, we spend 17.5% of GDP on healthcare in this country. That's too much. Okay. What's the right number? Anybody for 16.5% of GDP? How about somebody want 15.27? 14.3, anyone? The point is, I haven't a clue what the right percentage of GDP a country should spend on healthcare is. And neither does anyone else. I'm pretty sure we don't want to spend 1% of GDP on healthcare like, say, Bangladesh. Nobody's been advocating for the Bangladeshi healthcare system recently. But what is the right amount? That's what markets ultimately decide. How much you want to spend on healthcare versus how much you want to spend on automobiles or refrigerators or toasters or whatever. Now, we do have some problems. Number one is we don't really have a market in healthcare in this country, so we don't know how much we want to spend on healthcare versus toasters or refrigerators or whatever else it might be. But, and I think that that's something we need to fix. But I think we should be careful about simply saying we spend too much. Maybe we want to spend more. Maybe we want to spend less. I do believe we're not spending what we have efficiently, but to simply arbitrarily say it's too much money, we need to spend X amount less, I think we need to be careful of. And finally, I would point out that it is a problem that the distribution of healthcare costs is a problem, because that means there are some people who simply can't afford the prices or can't afford the healthcare that they want or need. And that's something that we're going to have to deal with. Which leads to the next problem we have in this country, which is, we have too many people who don't have health insurance in this country. Now, again, we need to be a little bit careful, because the numbers that are thrown around out there are, well, let's say misleading. The number you hear a lot out there, people will say there are 47 million Americans without health insurance. Sometimes it's 45, occasionally in an Obama speech it slips up to 50, but there's X million Americans without health insurance. The actual number, according to the Census Bureau, is 46 million Americans without health insurance. But that's very, very misleading. For example, of those 46 million Americans without health insurance, 12 to 14 million are currently eligible for Medicaid, S-CHIP, or other government programs and have simply not signed up for those programs. Now, we can have an interesting debate about whether we want to sign them up or not, but there is a question, do we really need a giant government program to sign people up for the giant government program they didn't sign up for in the first place? In addition, of those 46 million Americans without health insurance, about 12 million of them are not Americans. They are non-citizens, and about equally divided, about 6 million legal immigrants and about 6 million illegal immigrants in that population. Now, it's interesting, the President assures us, in the wake of Joe Wilson, isn't it? The President assures us illegal immigrants will not be included in the health care bill, which means no matter what, you will still have 6 million uninsured people out there. So, we should look at that. 43% of the uninsured have incomes over 250% of the poverty level that presumably could afford some kind of insurance, especially if we could make it cheaper. And finally, when we say there are 46 million people without health insurance, we have this sort of vision. There are these 46 million people, they were born without health insurance. 80 years later, they die without health insurance. They've never seen a doctor in between, of course, because they've never been insured. Well, first of all, being insured and seeing a doctor are not the same thing. People without health insurance do get health care. In fact, in dollar amounts, we spend about 2/3 as much on people without health insurance as people with health insurance. They do get treated. Now,